Thank you very much for asking me to speak here today. So it's getting near coffee time, so I'm not going to keep you for too long, hopefully. So firstly, can I say thanks to Agnes, Naomi, Jarlath and the rest of the research team for identifying that there was a need to and a value in evaluating the nursing service across the country. And I'd like to thank Epilepsy Ireland and the HRB for financing this research. As a group of nurses, I think it's fair to say we were pleased to see epilepsy nursing service evaluated, but perhaps a little cautious in hearing whether the results would reflect what we believe is a comprehensive and quality service which is provided to people with epilepsy and their families. However, from the SENS report, it is clear that the service is of great value to people with epilepsy and their families, and to the multidisciplinary team of people who manage epilepsy in the community and in the hospitals, and that it is value for money. It was great to hear from Sinead and from Joan about how the availability of epilepsy nursing helps them to manage their and their family members' epilepsy. Whilst both patient representatives spoke of the service they received in one particular hospital, I believe their experience is reflected wherever epilepsy nurses services are provided. Epilepsy nursing services have come a long way from their inception, and I think it's fair to say that the genesis of epilepsy nursing began with the paediatric service, where there were neurology/epilepsy nurses. I think Maria Keegan in Crumlin and Pam Knightley in Cork and Therese Nestor, who I see from Temple Street, were possibly the first neurology epilepsy nurse specialists. Therese I know from my time as a student nurse in Temple Street and was always a role model and remains a role model. Now I've lost my way there. Epilepsy nursing for the adult population began with the employment of a dedicated epilepsy staff nurse in a 2-bedded epilepsy monitoring unit in Beaumont Hospital. From its very humble beginnings, in what Sinead Murphy reminded me yesterday was a broom closet outside the epilepsy monitoring unit, the nursing service has expanded beyond recognition to what you've heard about today. The Commission for Nursing in 1998 allowed for the development of specialist nursing posts, and 15 years later, the Epilepsy Clinical Care Programme established that there was a need for specialist nurses to become pivotal team members in the care of people with the chronic condition that happens to be epilepsy. This research has shown what a team of highly educated and specialist epilepsy nurses can deliver on the ground and the difference that it can make. Team is the key word here. The report highlights that there is a need for and room for epilepsy nurses of varying grades, from staff nurses who work in the epilepsy monitoring unit, clinical nurse specialists in various locations and roles, both medical and surgical, and for advanced nurse practitioners, all who work with a multidisciplinary team, including medical staff, allied health professionals, and Epilepsy Ireland's community resource officers. This team of people manage and coordinate the care of people with a chronic condition. Many of our roles are supported and enabled by the National Epilepsy Electronic Patient Record, the EPR, whether they take place in the outpatients or on the phone, at an outreach clinic, in an ID centre, or in a maternity hospital. Care delivery is multidisciplinary, and whilst this report's focus was on the evaluation of the epilepsy nursing service, I suggest that this model of care can be utilised as a model of care for people with other healthcare conditions. As Joan has told us today, continuity of care is especially valued. People with epilepsy value consistency of care, as their care needs span a long time and in a lifetime for many cases of the people who transition from children to adult services. It is common for nurses who specialise to remain in the same disease area for many years. Specialist nurses are ideally placed to provide this continuity of care, which is such an essential part of providing care to people with epilepsy, and the SENS report reflected this finding. The SENS report also reported that the epilepsy nursing service provides a comprehensive and varied number of different but related services, and it has the potential to keep people away from the emergency room and to reduce the length of stay in both the emergency departments and when admitted, at no extra cost. There are risks to the sustainability of this service, and the report highlights these: heavy clinical workload, critical mass in some areas, and role isolation were identified as potential risks to sustainability. To future-proof the epilepsy nursing service, which in reality is still in its infancy, investment is needed firstly to ensure that the current nurses maintain their skills and develop further competencies as specialist autonomous practitioners. Ongoing investment is also needed to upskill new entrants to epilepsy nursing, to ensure that there's a cohort of nurses ready to become advanced nurse practitioners when new roles are identified or when posts become vacant. In healthcare, there's always competing needs, and any of us working in healthcare know the difficulty in replacing a post when it is lost due to the non-availability of a specialist person to take up that post. The SENS report demonstrated that the outreach clinics to the Intellectual Disability Service were viewed favourably, from reducing the distress commonly associated with people attending busy hospital clinics. It can also has the potential to reduce the costs associated with bringing residents along with staff to appointments. However, at this stage we do not have any epilepsy nurse specialists working in the intellectual disability sector. These nurses have considerable expertise and knowledge with people with epilepsy and intellectual disability. And I see the absence of epilepsy nurse specialists in the intellectual disability service as a gap in service provision. I feel there's a definite role for these posts to be championed and supported by the ID nursing service management and by third level institutions. The report highlighted the role that specialist nurses play in different types of education, the education of patients and families, and the formal and informal education of undergraduate and postgraduate nursing and of other health professionals. I welcome the recommendation in the report that epilepsy specialist nurses and third level educators explore the possibility of using epilepsy nurse specialist services as a placement for student nurse training. This exposure would hopefully foster a knowledge and an interest in young graduates considering epilepsy nursing as a career choice. Involvement in research is an essential component of advanced nursing practice. The report highlighted that a heavy clinical workload impacts negatively on research activities. Whilst this is a finding all sites would agree with, I think, I also think we can be justifiably proud of the research which we have led out on and collaborated in. And I agree with the recommendation that epilepsy nurse specialists forge relationships with nursing and midwifery academic schools to advance the research agenda in epilepsy nursing. While cost savings were not demonstrated, this study showed that at sites with epilepsy nurses there was an improved patient experience and better coordination and management of epilepsy care with no additional cost. During the time the report was being carried out and since its completion, a further 2 paediatric and 1 general advanced nurse practitioners have been accredited. The remaining candidate advanced nurse practitioners are currently preparing for accreditation, and I look forward to their accreditation. This, of course, is being done with the cooperation and the assistance of their relevant directors of nursing and the NMPDU. A transition nurse has been appointed to ensure a timely and patient-centred transfer from the paediatric services to the adult services, and a number of transition clinics have taken place, and I welcome this new role. An additional nursing service has commenced in epilepsy nursing service has commenced in St. Vincent's Hospital. Outreach clinics for people with intellectual disability and epilepsy have been expanded in Cork, and a date has been set for a new clinic from James's Hospital to Stewart's Hospital in Palmerstown. We look forward to working with people with epilepsy and their families in many areas of epilepsy. We look forward to the development of the Epilepsy Electronic Patient Record patient portal, where patients will have a link to their electronic record. There are, of course, gaps in the service. There are many neurologists working and delivering services still in Ireland without access to epilepsy nurse specialists. I know that the clinical lead for the clinical care programme, Colin Doherty, and the nurse lead, Cora Flynn, are aware of this, and I ask them to do what they can do to ensure that services without epilepsy nurse specialists are catered for. Finally, I would like to acknowledge all the epilepsy nurses for their commitment and hard work over the last number of years, whether they work in paediatrics, the adult services, epilepsy surgery, or in the community. Their drive and ambition to be leaders in the delivery of epilepsy care is phenomenal. And personally, I would like to say that the recruitment of the new epilepsy nurses that were recruited through the clinical care programme has been one of the most rewarding times of my career, and I look forward to them achieving status as advanced nurse practitioners in the coming years and months. Thank you.